Hepatitis C virus is responsible for worldwide incidence of hepatitis infections. It has known as silent killer. Almost 75% of patients are unaware of their infection. After acute exposure to hepatitis C virus, about 55 to 85% of patients develop into chronic hepatitis C. Most severe cases may develop into liver cirrhosis and liver cancer. From a global perspective, HCV affects more than 71 million people around the world, with 3 to 4 million new infections each year. In Taiwan, the prevalence rate of hepatitis C is 4 to 5%, which is significantly higher than the neighboring countries. Even though there are drug treatments such as DAA, and the cure rate of DAA can reach 97%, it limited to the high price, the long treatment course, and it only affects in 40 to 50% of patients. The current methods for detecting hepatitis C can divide into two parts. The antibody testing has lower cost, but it is impossible to distinguish the persistence or extent of infection. The nucleic acid testing has higher accuracy and better for early detection, but today's instruments, such as PCR, the operation is time-consuming and high cost. Here we develop a smart biosensing platform, which is suitable for on-site detection. The results can obtain in 15 minutes, and the detection limit can reach 1 genomic copies per reaction. Due to the special chip surface design, when detecting different targets, such as other infectious disease, we don't need to change the chip. The type of sensor we use is extending gate field effect transistor. Each feed has known as a fast, miniature, and easy to integrate transducer. It reserves the gate of MOSFET and keeps the sensing membrane away from the gate. The advantage is that we can easily change the form of the membrane. The application of each feed is to detect the concentration of hydrogen ions in solution. Ion can be released by the biochemical reaction to allow for sensing different biological samples. Therefore, we choose it for the nucleic acid detection. The technology used here can be separated into two parts. First is preamplification. RT lamp is different from PCR, only need 6 to 8 primers, and initiate isothermal amplification under 60 to 65 degrees by BST DNA polymerase with strand displacement activity. It can avoid thermal cycling for nucleic acid amplification. And the CRISPR system was used to highly specific identify and cut the target sequence. Combine these two technologies, the Cas12a can recognize the lamp applicant and activate the transclavage activity, generate a fluorescence signal. This is the overview of our platform. First, the target HCV will pre-amplify using RT lamp, then mix with CRISPR solution and transfer to the pMMA well under 37 degrees. Once the Cas12a cRNA complex recognizes the DNA applicant, which complementary to the cRNA, it will activate the Cas12a transclavage activity, cutting the single-strand DNA immobilized on the surface, cause the voltage change. The result on the percentage of voltage change in positive control show the single-strand DNA on the surface will cleave due to Cas12a transcleavage activity, and we can distinguish between positive and negative control in 15 minutes. Compared with other technologies, our biosensor is based on nucleic acid detection, which can obtain the results in 15 minutes, suitable for early detection. The size of our biosensor is small and portable. The price of reagent and disposable chips are cheap. The EasyFit biosensor we developed is wanted to provide a point-of-care testing platform to help for early hepatitis C screening, increasing the detection rates in Taiwan, and enable for primed treatment. The miniature sensor can be used for distribute on-site detection and can be applied to water quality detection or even made into a smart wearable device. Our feature is use the most advanced LAMP CRISPR-Cas12a nucleic acid detection technology combined with electrochemical sensing. We design the specific primers and cRNA that can identify key sequence of the viral genome, and also the circuit is designed by us. In the future, this smart biosensor can not only be used for rapid diagnosis of HCV, but also be expanded to early screening and monitoring of more disease, hopefully help making more progress in the detection of the entire medical disease.